Hi, my name is Katelyn Boland, and I will be talking about a summer research project conducted on a client with acquired apraxia of speech secondary to a stroke he had in 2017. So, our project was titled Conversation Therapy via Telemedicine During the COVID-19 Pandemic for Acquired Apraxia of Speech Due to Stroke. Here is a list of my co-authors. So for this project, we delivered our services multiple times a week via Zoom telemedicine to a male client in his 60s with acquired apraxia of speech secondary to a stroke that occurred in 2017. Our research began in May 2020, and this specific project is actually still ongoing. The basis of this project was secondary to our initial services with the client, which focused on Julie Wambaugh's sound production treatment protocol. So from the sound production treatment services that we worked on with this client, we created together with the client a list of successful strategies to use to increase intelligibility in the client. After gathering those success strategies with the client, we wanted to then provide him with multiple settings of conversation and new communication partners in order to promote response generalization of the client's new skills with other environments. So for example, the client had a few success strategies that included keeping a slow rate of speech, adding rhythm based on different stress patterns in syllables within words, as well as over-articulating sounds in these words. Here is a photo from one of our sessions where the client is receiving visual feedback as well as verbal feedback and some modeling. So throughout our sessions, instead of providing our client with specific long lists of all of his success strategies, we decided to come up with shorter phrases to remind him to implement those as he was speaking at a conversational level. So for example, he would be speaking, and if he made an error, we would prompt him with a phrase such as slow it down or stretch it out. As I mentioned, our research is still ongoing, but we have seen positive benefits in the client. We have seen him making gains working with different communication partners and in different settings for conversation.